do it more with their county nursing, I believe. And so I don't know that those, their costs might not be less. I'd have to look into that. But it's true, the victim compensation fund, it only kicks in if you have an identified assailant and a successful prosecution. Now I know from our standpoint at the medical center, nobody's going to go after anybody for bills related to a SANE exam. If they have insurance, we'll follow their insurance, but I think that our clinic would work with anybody who is in that scenario.
Can you talk about kind of your emotional approach during the exam? So, that our approach would be to listen and believe, and that's our focus. And I'm sure that these women have been traumatized and they're wanting to tell you their story and they're wanting to be believed. So how is your approach in response to that?
I mean, it kind of depends on the person. Each victim is a little bit different, and some want to tell you every detail and some don't want to tell you anything. And I mean, I really kind of just let them lead the way. You have to believe what they say. I do. And you have to ask them detailed questions, because law enforcement's going to ask them and everybody else is going to ask them that deals with their case. So, you do it in as a professional way and non-judgmental way that you can, and let them know that, you just need to get all the information. And, from my standpoint, it's a little easier because I just want to make sure they're okay medically, and I can go about it that way, and usually people are pretty open to that. And sometimes you utilize family to help you, and sometimes family are not help at all, and then you ask them to go do something else. But every case is a little bit different. Yes, ma'am.
I have two questions.
Sure.
So first question is, I know that you said they need to wear the clothes that they were wearing. What happens if they've already changed? Do they still bring those clothes with them?
Yep.
Okay.
And then I don't necessarily take the clothes they have on.
Okay. So they should bring them with them.
Mm-hmm. Exactly.
Okay.
Exactly.
And then my second question was, I know that you said that you take blood samples to do baseline HIV and syphilis and STD tests.
Mm-hmm.
Do you then also offer
So that's my next topic.
Okay.
Yes.
I'll let you go on to that.
Perfect. So after I'm done with the exam, we do a pregnancy test on every patient. We do tests for gonorrhea and chlamydia when we do the cervical swabs. And like I say, we do the blood tests as well. We offer post-exposure prophylaxis, meaning antibiotics or vaccines for any of the treatable conditions that she could have contracted. So we usually offer antibiotics for gonorrhea and chlamydia, and that's usually, it can be a shot and 2 pills or a total of 6 pills, and it's just antibiotics that will treat either of those infections if the perpetrator had that. As far as hepatitis goes, there's nothing that you can do as far as Hep C, but hepatitis B is a vaccine preventable illness, and so if they've not had the hepatitis B vaccine series, which like a lot of kids these days now do have, but we can give them the first hepatitis B shot, and then they can get a booster 6 weeks later. HIV is a little bit trickier because we do have prophylaxis for exposure to HIV, and it does decrease the likelihood of transmission by almost 20 times, so it is very effective. But it is it's a series of 3 medicines that have to be taken. 2 of them are 3 times a day, 1 of them is twice a day, and you have to take that for an entire month. And it makes you feel terrible, makes them feel like they have the flu every day. So there's a real downside to taking the medication. And a month of that medication is about $1,000. So it is not something that everybody elects to do. HIV is actually a difficult infection to transmit to another person, particularly if it's just vaginal intercourse. Anal intercourse, it has higher transmission rates. So I usually, if they suspect that the person could have had HIV or they are concerned about it, I always offer that they can take it. But it is kind of an intensive therapy course. There is an HIV clinic in Grand Junction, and they will work with victims of sexual assault and provide them their medications for free for a month. But they got to get themselves to Grand Junction to the HIV clinic. And then pregnancy prophylaxis I offer to all of my patients. And what that involves is it's Plan B, what they sell at the drugstore. It's basically 2 birth control pills now and 2 more 12 hours later. Most frequent side effect is nausea and vomiting, and so I usually give them some nausea medicine as well. It is not an abortifacient, meaning if the person is pregnant, if you give them that medicine, it won't make them abort the pregnancy, but it is a preventive measure. It makes the uterus inhospitable for implantation. And so if taken within 72 hours of intercourse, it's about 92% effective at preventing pregnancy. And so I always offer that as well. Yes, ma'am. Did you have a question? Oh, sorry. So that's the STDs and pregnancy prophylaxis. We always offer counseling and any kind of follow-up. And this organization has always been great for helping our victims. Any other questions? If we can ever be of service, we're at the medical center. 729-1089 is the on-call doctor number. And hopefully we won't have to talk about this. All right?
Thank you.
Thanks. Might have to get a new kit.
I've got a
And,
few. You know what? I gave one to